We're going to take a look at all of the plan options. You may or may not have been selling the basic and plus plans previously. Even if you were, it's always good to kind of get a refresher. Let's talk about it briefly. And again, like everyone has said so far, we'll answer questions at the end for those that come up. Very excited to be here today. Thank you so much. Let's just jump right in. So let's start with the kind of the 5 W's that I like to call. So who is this product for, right? Members who want or need protection for preventative, doctor visits, and now, of course, even some hospitalization. Members who have a medical plan currently, but do not have preventative and wellness. Plans like short-term medical plans, high deductible health sharing plans, or really any plan that doesn't include wellness or doctor visit benefits. Members who want an affordable plan while still maintaining high quality benefits, and members who have no current healthcare benefits. Of course, this plan can be sold standalone as well. What you'll love as the agent, obviously, if you've done this before, you know our enrollment portal, effortless online enrollments. Find all the details about the plan directly on the portal and enroll all on the same site. And with the added Simple Scripts RX we're going to talk about today, you can combine both of those into one cart. We're going to show you how to do that as well. Make more money, less work. That's always the goal, I think, for all of us. Easy to explain plan options. Make the Wellness 360 a breeze to sell. Done for you customer service. We work directly with HST to provide one-stop customer service and unmatched support. Training, assistance, teamwork with AOBG Services Division along with HST work together to provide you the best overall experience you could ask for. Stickability. We want those members to stay on the books. Combine our member services, retention, and reliable products creates a recipe for long-term clients month after month after month, which I know is what we all want. Reliability. We sell products that work every time. It's easy said, right? You provide your members with a level of trust when the product you sell them works the way you described it to work, bottom line. What your members will love, what they'll love, easy to utilize benefits. Physical and digital cards, trusted networks, trusted partners, no questions at the physician's office regarding their benefits or the PHCS network. Responsive customer support. Member Services provides accurate, reliable, and extremely responsive solutions to your members' needs. And the plan benefits. Members who purchase the Wellness 360 have access to 100% coverage for wellness visits along with co-pays to their PCP, specialist visits as well, as Sam was mentioning earlier, child, women, men's wellness screenings, including colonoscopies, mammograms, well women exams, well child exams, immunizations, and more. Plus, the additional hospital indemnity benefits really make this Wellness 360 plan your members will be happy with for a very long time. The network, PHCS Network, gives our members access to hundreds of thousands of physicians and medical facilities nationwide. The Wellness 360 is available in 44 states plus DC, so we're going to take a look at that as well. And the value-added benefits. Our value-added benefits complement the Wellness 360 plan, providing 24/7 access to physicians, dental discounts, hearing, lab discounts, and more. When is this product a good fit? That's a funny question. Anyone that's looking for affordable health benefits that won't break the bank, right? Again, when members have a short-term plan, maybe they don't include wellness or doctor visit benefits, when they have no current health care plan at all, or when they just need an affordable plan with real-world benefits they're going to use. Where can you sell it? You already know. Anywhere, right? Anywhere you're connected to the internet. Our portal can be accessed by home computer, laptop, iPad, Android, iOS, and all smartphones. Make a sell at Starbucks, your home office, from the car, wherever you want. Why? Give your members peace of mind. In uncertain times, it's extremely important that you arm yourself with the best products available that give your members peace of mind at a price they can afford. And those two things are extremely important. Can we give peace of mind, and can we do it at a great cost? And I think we've nailed that with the Wellness 360. Plan highlights at a top level here. You're looking at first, of course, if you're used to selling the Wellness 360, you're going to love the improvements, right? So we have 100% coverage for ACA, preventative, and wellness, obviously. 4 or 6 doctor visits. We all know that, depending on the plan level. This is a guaranteed issue product, no health questions. There's 4 plans to choose from. We're using the PHCS Specific Services Network now with generic drugs also covered. We're going to get into that as well. Available again in 44 states with those value-added benefits as well. Just so that we're absolutely above reproach here, we just want to make sure the Wellness 360 is fully insured, administered by Salveson Health, which is a sister company of Triada Assurance, and the program is actually reinsured by Swiss Re, which is one of the top 5 reinsurance corporations in the world. So we've got some great backing on this plan, and I just love it when a plan comes together. I don't know if anybody knows that quote, but you can laugh silently as you're muted. Little membership details here. So eligibility, right? Of course, your members must live in a state that the Wellness 360 is available in. They're going to be 18 to 64 years of age, and children are going to be covered up to the age of 26. With 4 different plan levels now, you also have your options for member, member plus spouse, member plus children, and family options as well. And of course, we kind of have to thank all of our agents for the valuable feedback. You know, when the first Wellness 360 came out, it was limited to 4 or 6 doctor visits to a PCP doctor each year. You know, we've had extremely great feedback, and one of the things that we've received was specialist visits. You know, what about specialists? And that's why we've added what we've added here. We've got 100% coverage for ACA Preventative and Wellness, coverage for adults, women, including pregnant women, and coverage services for children as well. Your doctor visit benefits, you have a $25 copay for your PCP visits and a $50 copay for your specialist visits. Now, both those are limited to $150 per visit, but still those copays will apply for a physician or a specialist visit within the PHCS specific services provider network. With the preferred and premium plan options, you're going to get everything that the basic and plus has included in it, with some hospital indemnity benefits as well. So coverage for room and board, benefits that pay out admission benefits for specific conditions like cancer, heart attack, and heart disease, inpatient surgery, outpatient surgery, as well as radiology, pathology, so lab work, emergency room visits, urgent care, and more. This plan is beefy, and we love it. Moving on, of course, we're going to add the Simple Scripts RX. This is something you don't see every day. If you remember selling the Wellness 360 prior, it did have a very small prescription benefit on there. We've amped that thing up. Simple Scripts RX prescription benefit. This is new and improved, provides members with access to 95 of the listed ACA mandated medications at no charge to the member, okay? So we've got 100% coverage for wellness and preventative. We're adding hospitalization benefits. They've got copays at $25 or $50 at a PCP or a specialist visit. And now we're adding 100% of their ACA approved preventative medications at 0 cost to the member. Now, if that doesn't get you excited, I don't know exactly what will, except maybe your add-on product for the Simple Scripts as well, which we're going to get into. So in just a few, we're going to show you the add-on prescription plan that will add access to hundreds of medications for only $1. So they walk in, show their card. It is a point of service situation. They walk out paying $1. It makes you happy, makes them happy, makes everybody happy, right? Smiling faces all around. And again, we're looking at top level stuff here. We're going to dive deep when we go into the enrollment portal here in just a few, but we're just showing you the top levels here. So basic through premium, we're looking at starting rates at $149 for the basic, and then going up to the premium, you're looking at $339 a month. Access pretty much nationwide. You shouldn't have a problem providing benefits to your members in need in the state that they're located. The only states not available to sell in, which is the easier way to put this, Maine, Maryland, New Hampshire, New Jersey, New York, and Washington. All right, so 44 states plus DC. Rates will start again at low as $49, go up to $339. And let's take a look at the network, PHCS Specific Services Network. So you may remember seeing the first health network on previous plan options. This change allows us to give your members more access to high quality care at deeper access to medical facilities nationwide, including an increased specialist network. Easy to search while on the enrollment portal. Simply click search providers, select PHCS, then specific services, enter that zip code, and you are good to go. We will show you the search function as soon as we get into the enrollment portal again. And so sorry about that background noise. You know, it never fails when you're on the training with hundreds of agents that a package from Amazon just gets dropped at the doorstep. So sorry about those barking dogs in the background if you can hear that. The Wellness 360 has always provided members with some of the best value-added benefits around, giving the plan a boost in usable, real-world benefits that complement the health plan that they purchased. With Teledoc, the telemedicine brand everybody knows and trusts, your members can enjoy access to a physician 24 hours a day, 7 days a week with absolutely zero consult fees, allowing them to speak with a physician and not worry about the cost. With My MedLab, Members can easily access to lab facilities nationwide using MyMedLab's online lab test portal. Buy labs, print a lab order, go to your local lab facility, and they will be notified of the results in a matter of days. They can even purchase an expert review on MyMedLab's website as well, or just take their test results back to their doctor for review. So listen, we want to make sure that they're saving money everywhere, 50 to 80% off of what the doctor's office would typically charge. And we utilize that MyMedLab network for that. Radiology tests also sometimes need to be done, right? Last thing we want is to worry about the cost when those things occur. So with one call care, members can focus on getting well and not their pocketbook, savings between 20 to 50% off of radiology testing when ordered, of course, by their physician. So they're going to utilize the one call care network there to bring the cost of any type of MRIs, PET scans, CT scans, et cetera, down, which is important. With Ice Tracer, another value-added benefit, easily store your important medical information, allergies to other meds, pre-existing conditions, previous medical history, and more, giving easy access to first responders and medical professionals in emergency situations. Let's Get Checked, another value-added benefit. This one is a great benefit. I love it. Members gain access to over 30 health screenings that can be done directly from the comfort of their home, and now includes COVID-19 testing as well. Test results are available in 2 to 4 days through a secure online account. Members receive a 25% discount on almost all tests when they purchase a Wellness 360 plan. Because of the demand for COVID-19 testing, obviously right now, that discount does not apply to that particular test, but all other tests are 25% off, which is why I said almost all. Right now, that COVID-19 test, no discount off. Still can be done at the house. Super simple. They send it to you, you send it back, you get your results in 2 to 4 days. Really simple. Additional savings, Beltone, 15% off of hearing instruments and a complimentary hearing screening. Cigna dental discounts between 15, 15, and 50 using Cigna's large dental network. And iMed will provide members with a 20% discount on glasses, lenses, contacts, and more with over 65,000 vision providers nationwide. Let's take a deeper dive. Let's get into the enrollment portal. Let's click this link and let's have some fun. So here's the enrollment portal. If you are not used to seeing this or have not made an enrollment yet, this is what the enrollment portal looks like. We're going to select Texas, the great state of Texas, which is where we're at, or I'm at today. Yes, it's 111 degrees out. The Wellness 360 basic floor plan iterations you can see here listed out, super simple. We've got the basic, you got the plus, you got preferred and premium all on one site here, and your Simple Scripts RX that we're going to take a look at. We're going to start with the preferred plan and then go to the premium plan. Keep in mind that the basic and plus are actually within the preferred and premium plans, which is why we're doing it this way. The basic still has 4 doctor visits. Wellness plus has 6. And the preferred, let's dive deeper into that preferred plan real quick. Let's get back to that. Okay, so on the preferred plan level, you're looking at, again, 100% coverage for ACA, preventative, and wellness. 3 physician office visits, so 3 PCP visits at $25, 1 specialist visit at $50. Both of those, again, are maxed out at $150 each. So copay plus the max of $150, anything over that would be the member's responsibility. All right, now in most cases for a physician's office visit, $25 copay and $150 is going to take care of most. In the event that there's additional payment, that's going to be the member's responsibility. We just want to make sure that you know that and you say that. It adds the hospitalization indemnity benefits along with the ACA, 100% for the ACA and the doctor visit benefit. Now, on the other 2 plan options, your basic and plus, you do not have any pre-existing condition limitations or exclusions, all right? It is a guaranteed issue plan across the entire plan set, so Wellness 360 is all guaranteed issue. However, on the preferred and the premium plan options, there is a 12-month pre-existing condition limitation on the indemnity benefits only. All right, still available in 44 states, 18 to 64, dependent covered up to 26. Let's dive deeper. 3 visits, $25 copay, again, $150 maximum. 1 visit for specialist, $150 maximum on this plan, 100% preventative, You know, a lot of the times we get questions, what about colonoscopies? What about pap smears, things like that? Colorectal cancer screenings here are starting at age 50, limited to once every 5 years. We know that doesn't say colonoscopy. We're going to look at the plan details a little deeper and show you exactly where it says it. Colonoscopies are covered if ordered by a physician. So scroll down, you can see all of the benefits here that are covered at 100%, including immunizations for children and adults. Services for women do include cervical cancer screenings, as you can see here, and mammograms. Mammograms start at age 40 for women and older, and they have them every year. You'll notice there is benefits for pregnant women as well, and this is something that comes up quite a bit. What type of benefits for pregnant women? We want to shy away from calling this anything close to a maternity plan because it simply is not, right? This is just not maternity benefits. However, if the woman is pregnant, there are pregnancy benefits that she has that are going to be paid and covered at 100%. And so those are listed here. As we scroll down, you see the preventative services for children. We're probably all used to seeing that by now. Hopefully you're selling a lot of these. And we get to the group fixed indemnity limited medical benefit now. These are the hospital benefits. So on the Wellness 360, again, this is the plan level 3. You have a $200 room and board benefit for 30 days, $200 times 30. A mental and nervous disorder benefit at $100 a day for 10 days. Substance abuse and alcohol abuse at $100 for 10 days. Hospital admission for specified conditions. This is what I was talking about before. So you have $2,000 for cancer. Heart attack, $2,000. Heart disease is $1,000. And you'll notice there, it's either or on the heart issues. So heart attack or heart disease will pay out. Accidental injury, 1,000 times 1. Stroke pays out 2. And then there is a childbirth benefit. Again, if they are already pregnant, let me scroll back up and just make sure. If they are already pregnant, we know that there's a 12-month pre-existing condition limitation on indemnified benefits. So as we look at the indemnified benefits, if they are already pregnant, this will not pay out. If they are not pregnant, when they purchase the plan option, become pregnant, there will be a childbirth benefit under the plan of $1,000. It's still recommended that if they become pregnant, they get with their doctor right away, especially if they don't have any other coverage other than the Wellness 360. They need to go to their doctor and start a payment plan right away. This childbirth benefit, as we all know, is not going to take care of the entire pregnancy or the childbirth. So we want to make sure that they have the proper information at hand. Yes, it does include a childbirth benefit. If they are currently pregnant, it will not be covered. If they are not and become pregnant, they do have the benefit. However, it is just $1,000 one time at the time of birth. Also includes a surgery benefit, $500 once. And as we scroll down, we also have outpatient benefits as well. So we have radiology, lab, emergency rooms, urgent care, and surgical benefits. These are all outpatient. So MRIs, you're going to get $100 for CT scans is $50 once a year each. And then all other radiology services, $40 3 times a year. Lab benefits for any pathology, $40 3 times a year. Emergency room benefits, $500 twice for accidental injury, $50 for sickness 3 times a year. Urgent care, $50 benefit once a year for a facility visit. And then surgery outpatient, they'll have a $500 benefit with a $100 anesthesia benefit. As we scroll down here, you can see the notations that I made earlier, payable for heart attack or heart disease during a coverage year, but not both. And as we scroll down here closer, you'll see 2 different things. You'll see certificate of coverage and general provisions. We're going to click on certificate of coverage at the end of this session to show you where the colonoscopies sit so that we're all aware and have that information. It is available for you right here on the enrollment portal. Nothing's secret for you, so you have the information that you need. Value-added benefits right down below, so we know we have access to Teledoc, Cigna, Simple Scripts, RX. That version of Simple Scripts that you see right here is not the version of Simple Scripts that you're going to be able to add on and sell. It's two different plans. Simple Scripts RX here gives them access to the 95 prescriptions at 0 cost. Okay, Ice Tracer, My Med Lab, One Call Care, Beltone, iMed, and Let's Get Checked. We already went over those. And as you scroll down, you get down to the enrollment portion of the plan. Let's go back and let's look at the Wellness 360 premium plan option. We're not going to bore you going through the exact same thing again. We're just going to scroll down to the medical benefits portion of the plan. So as we scroll down, let's look. Same ACA coverage, same doctor visit benefit, which will show you the difference there. For the indemnity benefits, you're looking now at $500 for 30 days. Mental and nervous disorder went up to 15 instead of 10. Same for alcohol and substance abuse, 15 instead of 10. Hospital admission benefit for the specified conditions like cancer, heart attack, heart disease, accident, injury, etc. go up. $4,000 for cancer, $4,000 for heart attack, $2,000 for heart disease, accidental injuries, $2,000. So basically everything doubles, right? Stroke goes up to $4,000. Childbirth benefit now $2,000 as well. Surgical benefit goes up to $1,000. It was $500 prior. And then your outpatient benefits, of course, increase. Radiology benefits increase. Pathology lab benefits increase. Emergency room benefits go up, except the sickness. We don't want them going to the ER for sickness, right? Urgent care visit goes up, $60 one time. And then your surgical benefit is $1,000 with $200 anesthesia. That's all outpatient. And again, your value-added benefits. The only other thing that changed on this plan between the two options that we're looking at here is the amount of doctor visit benefits, right? So as you're seeing here, your preferred plan option, you have 3 office visits at 25 and a specialist visit at 50. And it looks like to be the same on the premium as well. Sam, we're going to make a note here. I want to make a specialized note. I want to make sure this is not an error, and I'm sorry to throw this into the mix, but I just want to make sure that everyone has information. So Jennifer and Sam, I'm going to make sure that this is the correct right here. I'm going to screenshot this because other plan options are a little different. So, but right now we're looking at 3 and 1 here too. What I think it is 4 and 2, but I'll double check that. We'll make sure this is correct. PHCS network, let's take a dive here. So we showed you, we're going to look at how to look up doctors as well. So as you click that link here, that's on the enrollment portal. So as you're here on the information tab, you scroll down to the PHCS where it has this logo, and right underneath that, there's a search provider button. You can click that, and it's going to pull up this tab here for the multi-plan network. As you get to this, you're going to click on PHCS, and then you're going to click on specific services. Okay, so again, you're going to go to PHCS and then specific services, and that's going to allow us to type in a zip code or a specific provider or a specific doctor. Let's look up Dr. Smith, see if there's a Dr. Smith anywhere near me. And we're going to scroll down. So here's some Dr. Smiths near me. There's 24, Benjamin Smith, David Smith, etc. So you can also apply different filters if you're looking for a specific type, a specific hospital that you're looking for. And of course, hopefully you're speaking to the member and they know exactly who they need to go to. You can type in the name as they have told you, and you'll pull up that information. So super easy to use and easy to search. Let's scroll down one more time because I want to show you something else real quick, which is the access to the certificate of coverage. As we click on the access to specific or to the coverage here, to the certificate of coverage, it's going to pull up the actual certificate. And this is important that you have. This is an easy Control F if you ever have any questions. Going to provide the pricing up front. The member does receive this in their member portal right away. Obviously, it contains the benefits, the certificate of benefits here. That this is all listed within the member or your enrollment portal already. But there are some things that you want to make sure that you have access to, which is the colonoscopy. So as you scroll down here, you'll see all of these same benefits that we have listed. And then we get to cancer screenings, okay? Cancer screenings, colorectal cancer screenings, using fecal occult blood testing, sigma, yeah, you say that word, not me, or colonoscopy. And so, you know, it's going to depend on what the doctor has prescribed, of course, but it is a covered preventative and wellness screening at 100%. So I just wanted to make sure everyone saw that. That is something that comes up quite a bit. You do have available in your enrollment portal to have access to this. And so I would recommend that you do pull this up, at least save it on your desktop if you're not going to print it out. But if you do like that paper like I do, go ahead and print it out so you can mark all over it if you'd like. Gives access to the physician office visit benefit, the PHCS network. All of the details on the plan are located here. If you wanted to go even deeper, you can look at the general provisions on the plan, which is going to be all of the minute details. You have access to this as well. We put this in the enrollment portal so that you have every single thing that you might possibly need. Of course, access to Sam and I as well for direct questions at any time. Enrollment on the plan is super simple. We're going to go through one of those real quick, but as a refresher, I want to just touch on the basic plan option. Pricing starts at $149. You have 4 doctor's visits, 1 specialist, 3 physician at $25, 1 specialist at $50. 44 states, no exclusions on pre-X, and a guaranteed issue. Everyone should be familiar with this, but just as a general overview, wanting to make sure you see it, this plan has no hospitalization coverage. It is straight up the doctor's visit benefit and the ACA approved mandated preventative and wellness, plus your value added benefits, Teledoc, free and clear, simple scripts, et cetera, et cetera. Your plus plan option goes up. 4 physician office visits, 2 specialist visits at $50, guaranteed issue, same thing. Just take off the hospitalization and you've got it there. This is why I want to look up the plus versus the premium. Premium could be 4 if I'm not mistaken, but I just wanted to verify so that we're on the same page. Let's take another deep dive into the Simple Scripts RX. Now, this is a product that you're going to want to add every single time. And the reason why is because who doesn't like saving on prescription medications, all right? And, you know, getting your ACA mandated preventative and wellness medications is all good and well. But when you need a prescription that's outside of that, how about we include 200 common acute or chronic medications for $1 per medication and access to thousands of medications just at $10. It's super easy to pull up the information. We're going to show you that as well. They get discounts on pet medications. They've got a fantastic diabetic supply program as well. And then men's health included on this plan, generic Viagra and Cialis through mail order delivery only, but super affordable there as well. As we scroll down, you see it's pretty much sold everywhere. Let's click on Chook prices. You can see how easy this is to pull it up. So here we have all the medications listed out from A to Z, but you can simply click on here if there's a certain medication. I always use Lipitor just because that's what's put on here as an example. It's easy for me to remember. And press submit. You can see that when I type in Lipitor and my zip code, it's going to give me a price of $1. Okay. Now, this program, what's going to happen is when I go to the pharmacy for the first time, I'm going to pay $1. What Simple Scripts RX is going to do after that is they're going to get in touch with my physician who prescribed the medication for me. And if I turn it into a mail order prescription, they're going to do that for me. All right, and they're going to turn into a mail order prescription for a 90-day supply for me on this same drug is going to still be $1. All right, so you want to talk about maximizing the savings for your members. This is the way to do it. This is the plan to add. No matter what, put it up on the portal. Make sure it's in the cart. Let's look at pricing real quick. $44.95 a month. You sell the Wellness 360 Basic at $149. You add the $44.95 a month for the member for the Simple Scripts RX, and you are off to the races. This is something that's going to make them feel like they are protected. Home delivery available, obviously huge discounts. Customer service available. They're picking it up at their local pharmacy. What pharmacies are available? Talk about whatever. Any pharmacies available. Simple Scripts, how it works, obviously like we just did. Search for them, select it, save the money, send it to you. It's super convenient. And then your diabetic supply program. Let's take a look at that real quick. For those that do have diabetes, the first order has a free glucose meter. These are done by quarter. And so you can see here, 3 times a day test is only $44.99 per quarter. That includes the meter for the first round. All the way up to 6 times a day is $74.99 per quarter, and that includes their meter. Refills are available as well. Again, the same price because that meter is free initially, and then 6 days, same price as well. So awesome program here for diabetics. Great thing to add on, and something that I would think that you would want to every single time. Let's go through a sample enrollment. I'm going to click enrollment from this screen. You can do that on many different ways. If I go back and click info, I can click pricing here and press enrollment. On the information tab, I can scroll down to the very bottom and click enrollment here. Or if on this screen and I know exactly what I want to push, I'm going to push enrollment here and it takes me right to the cart. So I've added this product to the cart now. I want to add Simple Scripts though. I'm going to do that every single time because that's just what I'm going to do. I'm going to press back down here at the bottom. Okay, if you notice, I didn't use my back browser button. I used the button down at the bottom. I'm going to select my state again. And then I'm going to click enrollment on the Simple Scripts RX. What that's going to do is it's going to allow me to have both products in the cart, one charge every single month for the member. Of course, just like before, I can change member to member plus spouse, children, or family here within the cart. I can do the same for the Simple Scripts RX product. So Simple Scripts RX is a little different. member, member plus one, or family. All right, so 3 different price ranges here, 4 on the Wellness 360, but just change accordingly. Here, we're going to stay with just a single, right? We're going to have Wellness 360 Preferred and Simple Scripts RX. Now, you may get into a situation where costs could be prohibited. If that's the case, you can easily remove the plans here. Just press the red X on the right-hand side, like so, and it's going to remove the product, okay? Again, down at the bottom, if you wanted to re-add that product, just simply press back, come back to the screen, enter the product again, and you've got it right back into the cart. Press enroll, and here we go. Total cost out the door, $293.95. Press continue. Here we go. Now we're into the application. Super simple. Follow the red dots. The red asterisks are what we need to fill out. So first name, last name, address, contact information, phone and email address, of course, are important. Need that social security number. It's wellness benefits, date of birth, and gender. Of course, ACH, draft, or credit card are accepted. And then down at the bottom, we do e-signatures for every single application. Super simple. Cell phone or email address. Don't get confused and try to do both, okay? You want to do either or. It could mess up the system if you press both, being impatient. Once you press cell phone or email, just give it a moment. It's got to communicate, go up to space, hit the satellites, come back down. Sometimes that takes a little bit of time, right? So we want to be patient with it. Make sure that you send it over to them, get that accepting signature back, and then you'll be ready to go to submit your order. A green box will pop up here and basically say, hey, you are good to go, and then you could submit your order. For those of you that are used to doing this, you know how easy it is. Scroll back up to the top as we have an area for post dates and effective dates. I personally don't use post dates, but we do have that option here. It looks like it's set up that you can post date up to a month in advance. This is for in the event that you have someone that maybe doesn't get paid today, you're on the phone with them today and they don't have the money today, but they need to enroll, say, on Friday or next Friday. You know, obviously talk to your uplines about what you're doing with post dates and whether or not that's something that you guys want to do, but it is here as an option. Just make sure that when you change your post date, it does change the effective date on the plan. That's why we typically stay away from them. So anything between the 21st through the 5th is going to have a 15th effective date. Anything through the 6th through the 20th is going to have a first effective date, okay? So 10 days basically before. So 21st through the 5th, 15th, 6th through the 20th, a first effective date. All right, so I'm going to clear this back here. And just one time, I did get word that the preferred plan is correct, so I just want to touch it just one more time, make sure that everyone has exactly what they need. What's on here is correct. 3 physician office visits, 1 specialist visit at a $50 copay. Again, I think that's it. Let me go ahead and get back to the slideshow real quick and see if we have any questions. Or Sam, you have anything to add?
Great job, Vince. And yes, we do have questions. We have a lot of them.
Good.
Yeah.
All right, so I'll just, I guess I can just read through these questions to you, Vince, and you can help me answer them. There's some good ones on here that I'm not sure of. First one actually coming from Justin. Do the old plans prior to the specialist copay and other stuff that was added that was submitted months ago, do they still use the First Health Network or do they switch over to PHCS?
The old plans currently are all the same. We have not made any changes to the old plan structure. I'm going to add a ... to that. Things are on their way. But right now, everything's the same.
Okay, perfect. And then do they get the network repricing with PHCS?
Yeah, so you know, they have access to that network. That network logo is going to be on their ID card or on their healthcare card. So they will have access to negotiated reduced rates by being a part of the PHCS network.
Perfect. Yeah, that's key.
Yep.
And then for the specialist visit, does that include psychiatric?
So we want to be careful with things like that, right? Not just because of cost prohibited, but you know, you're talking about 1 or 2 visits, and with someone that is going to psychiatric care, you're probably going more than 1 or 2 times. And so I tend to shy away from saying that everything is accepted like that. Utilize the network. If they're on the PHCS specific services network, then yes, right, it can be covered. But you're talking about a $150 limit. and you're talking 1 or 2 visits. So we want to maintain that there are usable benefits here for specific situations. And I just get uncomfortable when it's something that's going to be long-term, ongoing, and they only have 2 visits. Does that make sense?
Yeah, absolutely.
Okay.
Especially for a mental health issue that may be ongoing like that.
And that's the other thing too, is, I've gotten the question before, is mental health a covered benefit? The ACA mandate does have a depression screening as covered as 100%, and we have the same, but it's just a depression screening. It's not ongoing care. Anything after that's going to be out of pocket, and you're going to have the network repricing through PHCS. But you're getting into a cash pay basically situation.
Sure. So even after they did reach their limit on either PCP or specialist visits, they still would have that network rate after that fact?
Yes.
Okay, great. Next question. So if they are pregnant, we can sell them, right?
Yeah. So again, this is something that comes up quite a bit. I don't know if it's just in the COVID water right now or what, but it's yes, absolutely. There are no pre-existing condition exclusions. It's guaranteed issue product, okay, across the board, except for the hospital indemnified benefits. So yes, you can. Yes, there are benefits. Stay specific with which benefits are allowed. Let me pull this back up just real quick as we're answering that question, so we have some visual as well. So I'm going to scroll down here. We see covered preventative services for women, including pregnant women. So this is the answer is yes. You do have benefits. You see here what those screenings are. Be very specific with your member at that point, right? This is not a maternity benefit. This is not going to pay for your maternity care. We're not talking, even when you talk specialist visits. Okay, when we go back up, we want to be very, very clear here, right? Physician office visit to treat injury or illness, right? Specialist visit to treat injury or illness. So be careful, make sure that we have the right screenings here in front of us. We explain exactly what those screenings are and what they have access to, and just be very clear with them of what the coverage actually is. If they have currently are pregnant and you're looking at one of the top 2 options, the preferred or the premium plan, they will not have any type of benefits in the hospital indemnity portion of it for that childbirth benefit because it's a pre-existing condition, right? So this childbirth benefit is not going to be payable at that point. Is that?
Yeah, makes sense.
Okay.
Next question is, how do we get to the portal? How to get to that portal, we make sure that we're contracted. After this, I'm going to get with both Jackie and Jennifer, make sure we have everybody all the information they need, make sure they get that link.
Yep.
Next question is, which PHCS network specifically? And that's the Specific Services Network, right?
Yep, let's do it once more. So we're going to go PHCS. We're going to click right there on that, on the enrollment portal has that link. Show you that one more time. Just click on that right there. And it says specified services here. So now we've clicked that link. We're going to select network, select PHCS, which is what we're using, and then Specific Services Network. And now you're in the club.
Perfect. PPO discounts do apply. Question is, how strong is the network negotiator rate with PHCS? That's kind of hard to pinpoint.
When we talk percentages, everyone gets in trouble, right? So, I've had great experience. Other agents have had great experience with the PHCS network. 50% has been thrown out, but we want to steer clear of things that get us all in trouble, right? So how good are the repricing discounts? PHCS is one of the #1 in the nation, right? So we have changed from First Health to PHCS for 2 reasons. #1, to add a stronger network for our specialist visits and our PCP, and to provide a deeper discount, a deeper price range for our members utilizing these benefits. So that's the reason why we went here. First Health is a great network as well. No shot down there. It's just we felt the PHCS Specific Services Network fit for what we were trying to accomplish here with the Wellness 360 plan.
Absolutely. Are they going to be covering 3D mammograms or only 2D?
2D.
2D mammograms only, okay. Because this is an indemnity, pregnant fathers can get this, correct?
Yes.
Yep. So anyone can get it. Is there a wait for cancer?
Well, So there's no waiting period on this plan regardless. Okay. So
Right.
just no matter if it's the basic plus preferred or premium, right? The only thing with the preferred and premium, if we're talking to someone that has cancer, there's a 12-month pre-existing condition limitation on indemnified benefits for cancer. So you really wouldn't want to probably sell this plan for someone with that type of condition and already contracted with that condition, because really a lot of what they're going to go into the hospital for is probably going to be subject to that issue, right? And so want to make sure that we're selling this the right way. Although they would have the benefits for 100% coverage for wellness and preventative, that benefit would be good. The cancer, if they currently have it, would not. It would be a pre-existing condition and would not pay out under the hospital benefits under Plan 3 and 4. So can they get the basic and plus with no issues? There's no waiting period. Yes, absolutely. There's no pre-existing condition exclusions. There's nothing there that would stop them from getting that. On the hospitalization, especially if they're bringing up a specific condition like that and they already have it, I would say no, it's not worth it.
Right. And then with the PHCS network negotiated rates, they would also be getting those on the hospital services as well, correct?
Yes.
All right. Another question about mental health as well as PT or chiropractic coverage. I think you kind of touched on this earlier. Basically anything with a limitation like that, whether it be mental health, PT, or chiropractic, they're not going to be able to go 20 times to the chiropractor. They would have those limitations of one specialist visit.
Yeah, right. And you're talking even if that's allowed under the copay plan, injury or illness. Yes, it could be an injury. Yes, you can go to a chiropractor under the plan. We're talking a PCP. Chiropractors do not fit that mold. Could fit a specialist. But again, you're talking one visit. That's not why you're going to the chiropractor, right? And just so that we're clear, I also use a chiropractor. I know many of us do. There's a lot of agents on this call here so we have a lot of people that probably use chiropractors. Cash pay rates for chiropractors are really good nowadays, and usually outweigh any benefit that an insurance plan can give.
Right. Are all the benefits automatically enrolled? I'm assuming that means all the additional benefits.
Yeah. So no. So like other value-added benefits, and because of HIPAA, right, we can't just push their information to other companies. So what they'll have is when they enroll, they have access to a member portal. That member portal has all of the information on how to enroll in each product. I'm going to pull up an example real quick. If you give me just 1 second, I think I can pull it up. It's not going to be HST specific, but I think we'll get the idea of what the member portal will look like or what they have access to, which might be beneficial for everyone. So just give me 1 second here. And letting the internet catch up to my clicking. And we're going to go Wellness 360. 1 more second, I promise. We're almost there. Okay. So this is kind of what a member portal will look like. So they'll have the information about the plan here, plan documents, general provisions, which you also have access to on the enrollment portal. Their group number right away. As you scroll down, it's going to have the provider. This is what the members receive. Okay, so this is what they get. They also receive a call from member services as a welcome call just to make sure they understand what they have and how to use it. Prescription lookup here, $0 formulary, Simple Scripts RX for the MEC is all here, clickable. Simple Scripts benefit descriptions here. And then underneath that, member access information. So on each one of these value-added benefits is going to have this same little box here that's going to explain exactly how to utilize the benefits, how to enroll in each one of them, and with contact information for the respected benefits. So as we scroll down Teledoc, here we go. So you got access to information. Here's how to do it to set up your account. Scroll down My Med Lab, all the same. Go to depotmymedlab.com. Those are going to be automatic, as you see here, right? So each one of them has the description and how to.
Great. Next question, can Simple Scripts be enrolled separately, standalone? And yes, it can, correct?
Yep.
Perfect. Are you able to have a different number of members on the script?
Now, so yeah, so I wish that things weren't limited in that respect, but when we talk technology, it does seem to freak the system out when you do one for single and one for, husband and spouse or whatever. You want to keep it, whatever it is that you've written for the Wellness 360, you want to do the same for the Simple Scripts.
Perfect. Okay. So I guess that answered a couple other questions there. And then Tiffany wants to know if we want to switch our clients from the old plan to the new plan, do we have to do a whole new app?
So currently, that type of process is not. So no, we don't want that to occur. We are working on making sure that every member has access to the same benefits. Is that clear with the muddiness of that? I know I can't say much about it, but everyone, we're getting to the point where everyone will have access to the same benefits. So not necessary, but hasn't happened yet. I hope that's okay to say.
Sure. Okay. So it sounds like in the future, there might not be an issue.
Very soon.
Okay. Will a prospect with diabetes be covered for routine office visit checkups? Are diagnostic blood tests covered?
So again, we're looking at diagnostic. I tend to shy away from as well. The PCP visits are for injury or illness. Okay, diabetic could technically be an illness, but that's not what they're talking about. You know, the specialist, again, injury or illness, and for preventative and wellness certainly is not going to be covered because it's diagnostic. I say no to those. I don't like giving out benefits that aren't going to work for the member. Can the doctor code it in a way that's going to help allow them to gain access through that network and get that copay? Possibly. Is it going to be more than $150? I don't know. I don't know what's going to happen in that doctor visit benefit. Lab work is probably going to be done. It's going to go outside of what the plan was built and intended for. So anytime that happens, anytime I have to read into what's already written here, I say no to as an agent, because if it's not here, or if you scroll down and you download your certificate of coverage and you type in diabetics, diabetes, there's not going to be a single thing that you're going to find that's going to be helpful for your diabetic members, except Simple Scripts RX and the diabetic supply program, right? However, I mean, you type in for diabetic medication, it's skyrocket. The prices are insane. We all know that, right? So I like to shy away from making sure that our members understand what this product is used for. 4 doctor visits a year for a PCP, going to the doctor if you're sick or if you have an injury. Same for the specialist. And then giving them access to 100% coverage for ACA mandated preventative and wellness, plus of course our new upgraded prescriptions on it too.
Great. Next question, does this plan qualify as minimal essential coverage? If we've got a client that lost coverage through their employer, will this satisfy the MEC requirement to qualify for other ACA coverage before open enrollment? And that answer is no, correct?
Yes, that's correct.
Yep, this is a wellness plan, not a MEC.
Correct.
Network repricing for hospitals also, the answer is yes. Is this considered an insurance plan or a membership plan?
It is fully insured.
Great.
And it's reinsured by Swiss Re.
Okay. Is there a side-by-side comparison? You can kind of see that right on the site there. You can see the different options based there. And yes, Simple Scripts can be sold as a standalone. A couple questions on specific medications, and there is the prescription lookup tool. So you can do that not only with your zip code, but also the specific prescription.
Mm-hmm. There's also a formulary that you have access to on your enrollment portal here under prescription lookup. If you click the dollar medications, it's going to pull up the dollar formulary. So you can kind of control F here and find the prescription if they're bringing up a specific prescription that they take. You can find that here on the dollar formulary, or if you need to go a little bit more in depth, you can click check prices, and that's what takes you to the medication script lookup. You want to make sure to type in their zip code and then the specific drug name. Also, when looking up medications, it's important, even with something like Lipitor, right, which seems pretty simple. There are more than one Lipitor out there, right? If we were to look at another medication, then I wouldn't know which one to pull up. But you just got to be careful because different milligram strength, different versions of the drug are out there, and so you want to be very specific with what you're looking up. And it could affect the pricing drastically. So just make sure you have the proper information when you're looking up medications. Same thing with doctors, right? You want to make sure you have the right doctor information, especially if the doctor's name is Mr. Smith.
Right. How long can a client be enrolled in the plan? 6 months, 1 year, 2 years?
As long as they are good paying members.
Exactly. Are injectables covered?
No. You will have, so again, I say no, right? Sam, do you have an example? I know, is it metformin? Is that correct?
Metformin would be the pill.
It's the pill. Okay, so let's get
Glipizide, that'd be one.
lipicide.
Glipizide with a G.
Oh, LIG.
Glip, GLIP.
Well, here we see nothing, right? It's not, there's nothing here. Lipitor, Lipidox.
That's a glipizide, GLIP.
How about this? Is that the same thing, maybe?
Type in glipizide, G as in Greg, LIP. There we go.
Oh, sorry. Listen to the words, Vince. Listen to the words. So here, it's calling it a tablet, so this is not correct. So no, the answer is no, and if they are, it's extremely high. It's just not something that's feasible, really, most of the time.
Okay. So it's guaranteed issue, but on the hospital indemnity plans, there are no questions, but the only exclusion would be pre-existing pregnancy question.
Yeah. Well, all four are guaranteed issue. So there are no health questions across the board. And the only thing is that any pre-ex that they have on plans 3 and 4 are going to be subject to a limitation, a 12-month waiting period based on just the hospital indemnity portion of the plan. They'll have access to everything else, and they'll have access to the hospitalization, just not for their pre-ex.
Okay. Office visit covered for wellness and also illness injury. Yes.
Office visit covered for wellness. Well, so your wellness is covered at 100%. So that doesn't count towards your copay. So you don't pay a copay when you're using the plan for the preventative and wellness. So all of these screenings here that we see here listed as 100% pay, there's no copay at all. The copay is separate of the preventative screenings for men, women, and children. In addition to the preventative screenings, you have access to 4 or 6 doctor visits with a copay at a physician utilizing the PHCS network.
Perfect. Can it be child only?
No.
Okay. Got to be 18. I just tried to quote from Missouri and it shows no plans. There's their new enrollment link. Dan, I will double check on your link. You might just not have Missouri listed or something.
Also, Sam, a lot of the times what we see happen is there will be a license that maybe expired last month or this month and it turns off. So it's just a little double check there. Yep.
Chances are you probably had a birthday recently.
Exactly.
Can this plan be used in conjunction with other plans, or is it only to be used standalone for claims risks and testing?
No, absolutely can be used. So when you say used in conjunction with, it's not going to pay for other plans benefits. But it can be added to, like I said before, you sell maybe a short-term medical plan, right? Short-term medical plans don't have wellness benefits. Or a lot of the times they don't even have doctor visit benefit, right? You might sell a high deductible short-term medical plan option with a $10,000 deductible, and there's no daily living benefits. So you would want to add the Wellness 360 Basic or Plus to that to provide them with a little bit of a, if you get sick, you want to go to the doctor like a normal human being, you have the ability to do that, and it's not going to break the bank, right? You're adding $149 or $169 per member to do that. So it'll work along with other plan options as long as you're selling it with the understanding that you're trying to fit the Wellness 360 in a spot that maybe is already missing for the member. So short-term medical, high deductible plans, any plan that doesn't have a wellness portion or a daily type benefit, doctor visit benefit already to the plan. What you don't want to do is sell them an ACA plan, a major medical, and then Wellness 360. That wouldn't make any sense.
Sometimes though, sometimes, shoot, we've seen it where there's a really crappy bronze plan with a really awful network, and then all of a sudden,
Yeah,
Yeah,
$12,500 deductible, $25,000 deductible, something crazy. Yeah,
and no doctors anywhere. You know,
that's
so we've
exactly when you add the wellness.
yeah, so we've definitely seen that too, where someone loses their doctor from one year to the next, so now
Yep,
they want to keep them.
yep.
So next question is, what if a woman needs a mammogram under the age of 40?
It's not going to be covered under the preventative and wellness. Possibly get the PHCS negotiated rate. Not going to fit really under the doctor visit benefit, so it's going to be negotiated right through PHCS, if anything.
Yep, which still be better than nothing, that's for sure.
A quick question here from the other Q&A. Do we have access to, or is there a list bill option?
Currently, no, we do not have a list bill option for these plans.
We had another question about anxiety and Dr. Weekly, but if you're seeing a Dr. Weekly, this wouldn't be the right plan because you'd run out of visits pretty quick.
Yep. Now, if they're already paying, you know, Sam, there's a back and forth with that, right? So, is your member already paying, you know, every month, every 2 weeks to go to that doctor anyway, cash pay, and they don't have any benefit, right? So, can they purchase the Wellness 360 beyond that ailment? And the answer would be yes. You just have to make very clear that, you know, specific to that ailment we're bringing up, whatever it is, not going to be the reason why you're going to want the plan. You're going to want the plan because you want a preventative. You want to be able to get your wellness visit done. You want your annual checkups done. You want to make sure that you're healthy. You want to have access to other doctor visits if you get sick, not specific to your current condition, but if you become ill. And you want access to Teledoc for 24/7 access to a doctor without $0 consult fees. You want access to, you know, 100% covered prescriptions if they're preventative and wellness. You want access to dollar prescriptions, right? On the Simple Scripts RX. So, you know, you have a condition. Yes. Will this plan pay for that? Is it smart for you to pay for this plan for that condition? Absolutely not. But is it smart to have some form of coverage that you can go to the doctor and you can get your wellness and preventative done regardless of your condition? Absolutely yes. And we're talking $149. So to me, you have to make sure that, you know, you position it the right way, but I think personally anybody can buy the Wellness 360.
Sure.
And did you address the repricing for pre-X conditions?
Repricing for pre-X.
So anything that's excluded, is there still repricing?
So no, so, you know, the 12-month pre-X is going to it's going to be the top line. So the first thing is that if we're talking about the preferred or premium, okay, you're seeing here 12-month pre-existing condition limitation on indemnity benefits. Anything that they're probably going to go get done for their pre-X is going to be indemnity, which means that nothing's going to pay. The plan's not going to pay out. There's a 12-month pre-existing condition exclusion on this plan. So will not pay out. Any pre-X will not pay out.
And is there an extra cost for the telemedicine services?
No, there is not. It's included in the plan option. That's a good question.
Are there any limitations on where they can get their colonoscopy or mammograms? Can they go to hospitals or imaging centers?
So you want to utilize the benefits within, number one, the PHCS network, obviously. And then your certificate of coverage here, as you scroll down, let's just get real specific with it. Sorry for my dogs in the background again, if you can hear them. And number one, we already went and saw where you see, right, colorectal cancer screenings right here. At the bottom of this, you'll see here, as I continue to scroll. There we go. So for physician specialist office visit benefit is the PHCS network, and then down here, preventative and wellness. So you must use the PHCS specific services network, and anything outside of what is covered for the preventative and wellness may be charged as well. But there's nothing here that states whether or not you need to do it in a hospital or at a facility, you're going to be charged more at a hospital. There's probably a greater benefit to do this in an outpatient than to say in a hospital, but there is no difference between the two. The only thing I would be concerned with is the out-of-pocket cost associated with that preventative in the event that there are other things that are being charged to the member during that visit, right? So all of these benefits rely upon the physician, the attending physician, to code the information properly as a preventative and wellness plan or a preventative and wellness visit, not diagnostic, not ongoing care. And so those are all very important things to make sure that we bring up. It doesn't really matter where you're getting the service rendered. What really matters is that you're getting the appropriate service rendered for your plan.
A couple last questions here, Vince. Is there a limit on the number of preventative services a client can do in a year? Basically, whatever is age appropriate, right?
Correct.
Okay.
And the limitations are all included here. So you'll see that autism screening, right, covered preventative for children, is limited to 2 up to the age of 26 months. Behavioral assessments limited to 5 up to the age of 17. So all your limitations are already here on the screen, and you can rely on this to be absolutely accurate because we pull this right from the certificate of coverage, which we also attach to the enrollment portal anyway for you.
Okay. And then what kind of start dates do we have? First of the month, 1st and 15th?
1st and 15th. So again, from the 21st through the 5th, you're looking at a 15th effective date, and from the 6th through the 20th, you're looking at a 1st effective date.
Okay.
So again, 6th through the 20th, 21st through the 5th. So, and then your effective dates, they affect your ongoing. I'm going to pull up a little slide here real quick, actually, to just make sure everyone has a visual. I want to make sure they see exactly what I'm saying here. Give me just 1 second. Because that's important, right? We want to make sure people understand when everything's going to be effective and how that works. So here we go. So effective dates cut off of the 20th. So from the 21st through the 5th, you have a 15th effective date. From the 6th through the 20th, you have a 1st effective date. Recurring drafts based on effective dates. So if they have a 1st effective date, meaning you sold them between the 6th and the 20th, their reoccurring drafts occur every month on the 25th. If you have a 15th effective date, meaning you sold them from the 21st through the 5th, you have a reoccurring draft of the 10th of each month. And I'll keep that on the screen so people can write that down.
Great. Any more questions? We had a lot of really good ones. I think we hit pretty much all of them.
I think anything else that we were unable to answer, we'll try to answer offline.
Sure.
Since we're already a little bit over here.
Okay, perfect.
Thank you, everybody. Thank you so much, Sam and Vince. This was very informative. We will have this recorded and